We keep using these terms of perimenopausal or premenopausal, menopause, and postmenopause, but it's really helpful to distinguish what all of these terms mean. So perimenopause refers to the transition period between your reproductive life, so having regular periods and being able to conceive, up to starting to be postmenopausal, so essentially when you can no longer conceive and no longer have a reproductive life. And the transition from perimenopause to postmenopause is called menopause. So menopause refers to that specific date in time when it has been exactly 1 year since your last menstrual period. So as you go through perimenopause, which is a period that we know now takes 2 to 15 years, depending on the woman, is a transition where essentially we see levels of progesterone starting to linearly decrease over time. So every month you'll have a little bit less progesterone in your body. And then after a couple of months or a couple of years, depending on the person, estrogen starts decreasing as well. However, unlike progesterone, which kind of starts decreasing every month consistently, estrogen decreases in a very unpredictable way. So some months there might be more of it, sometimes less, and over time it does decrease, but it does so in a very hectic way. And because so many of the symptoms that we experience in perimenopause are linked to those estrogen fluctuations and will feel very familiar, things like brain fog, anxiety, irritability, low mood, those are all estrogen-dependent symptoms, and they essentially vary as your cycles start varying and as your estrogen levels vary as you approach menopause. And so for women for whom perimenopause takes 10, 15 years, it means they might be living with these symptoms of brain fog, anxiety, irritability, difficulty making decisions for years. And what's worse is that they don't really know when to anticipate them. Unlike, PMS symptoms, which hit you every time before your period comes, perimenopausal symptoms are much more hectic because some months they might hit at one time in a cycle, sometimes it might hit at another time of the cycle, and that's just dependent on those estrogen levels. So it's very important to recognize that perimenopause is a very unpredictable time. And on top of that, you have these irregular periods, so you never know really which one will be your last. But after it has been 12 months since your last period, then we say that have hit menopause and you are now postmenopausal and it's a new normal. And so the entire transition from being perimenopausal and starting to experiencing these fluctuations until you become postmenopausal can take anywhere from 2 to 15 years. And many women might not even know they're perimenopausal. But if you are starting to see that you are having slightly irregular periods, a lot of these symptoms hitting unpredictably, it's a good indicator that probably your estrogen and progesterone levels are starting to shift and that you are in perimenopause. So understanding this hopefully is very empowering to knowing that you can be in charge and taking control of these brain behaviors as your hormones continue changing in a very natural way.